Hello and welcome to this week's episode of Dada's Show, coming to you from Pullman, Nairobi, here in Upper Hill. I'm your host, Ashiko Mbune. As our name suggests, Dada's Show aspires to promote the spirit of sisterhood and solidarity amongst the women of Kenya. And we do this by creating an open and a safe platform for women to discuss any and all issues ascertaining to their health and well-being, their lifestyle and career, their families, among other topics. We also take pride in having the conversations that matter, not only to women, but to communities at large. Menstruation is a natural and biological process. Yet for so many women around the world, it is still covered in silence, shame, and stigma. So often is periods treated as something embarrassing and dirty, whereas it is a natural and occurring phenomenon for all women. Periods are actually a sign and an indication of power and actually life and health within a woman. In Kenya, very many women fail to show up for school or work because they cannot be able to manage their periods with dignity. Others face painful disorders that stop them from operating normally, while others face cultural barriers that stop them from accessing the healthcare that they need. On today's conversation, we are stopping the silence. We are breaking the silence, we are addressing the stigma, and we are addressing the myths on menstrual shaming. Today we will be joined by experts who have in-depth knowledge on how we can be able to stop the menstrual stigma and we can be able to address the concerns of the Kenyan women and girls. As always, we welcome you at home to take part and keep this conversation going on all our social media pages at Dada's Show across all social media platforms. You can also reach us at KBC Channel 1 across all social media platforms. You can reach me personally at Ashiko the host across all social media platforms as well. Before we get into today's very insightful and engaging conversation, let's take a look at the following feature.
Every month, millions of women and girls in Kenya face a natural reality, menstruation. But for many, this biological process is accompanied by challenges that affect their dignity, education, and health. Studies show that 1 in 10 schoolgirls in Kenya misses school during their periods, with some even dropping out completely. The main reason is lack of access to affordable menstrual products and supportive facilities. Sanitary pads cost between 50 and 100 shillings per packet, too costly for families already struggling with basic needs. In rural areas, some girls turn to improvised materials like cloth, tissue, or even leaves, putting their health at risk. But change is slowly taking root. Non-governmental organizations and community groups are introducing alternatives like reusable pants and menstrual cups. These offer long-term and eco-friendly solutions while also encouraging open conversations about menstrual hygiene. The Kenyan government has also stepped in with programs to distribute free pants in schools under the Basic Education Act. Yet inconsistent funding and supply gaps mean many girls are still left behind. Beyond access to products, experts say stigma remains the biggest barrier. Cultural taboos often prevent open discussions, leaving many girls misinformed and isolated. Community health volunteers emphasize that normalizing conversations around menstruation empowers girls, supports mothers, and strengthens entire communities. For Kenya, menstrual care is not just about hygiene, it's about education, equality, and dignity. A future where no girl misses school simply because of her period is still a work in progress, but one worth fighting for. Edna Murungi for Dada Show.
Welcome back. If you're just joining us, this is Dada's Show, and our conversation of the day is From Stigma to Strength. This is a conversation on menstrual care and management in Kenya. And of course, joining me in this discussion is obstetrician and gynecologist, Dr. Judy Edinji, who will give us her expert insights on menstrual care and management, and of course, how we can be able to move away from this dark cloud of stigma when it comes to menstrual periods. Karibu sana daktari. Right next to her, we've got Michelle Wanjiko Kira, who is from the Grace Cup company, who will tell us more about this wonderful innovation and why so many women are onboarding with this particular product. I think we also even have some users in our audience who will tell us what the experience is like, and of course what role the reusable products are actually bringing towards the economy and how they're elevating the stress that it causes for young women and girls. And finally, we've got founder and CEO of Teenage Moms Empowerment, Jerry Kabiro. Jerry is not a foreigner for Dada's show. She has been here many a times, and we really enjoy having her. And today we are looking for the insight and actually the connection between period shaming and teenage pregnancies. And many may not understand that, but there's actually a connection. You know, you've been running an online campaign that has actually hit how many? 3 million? 3 million views as we speak, and we are really looking forward to hearing what that is all about. Of course, I cannot fail to acknowledge my wonderful, wonderful, very diverse audience who are joining us. We have women of all ages who are sitting with us, all for us to have this conversation. Asanteni sana for making time to be with me. I also cannot forget to acknowledge you at home for tuning into Dada's show each and every week as we explore, as we learn, as we unlearn, as we support each other through communication. Okay, so let's start off from the basics. Menstruation is natural, yet it's it remains heavily stigmatized, you know, and the irony is it honestly should be looked as a sign, you know, of life and health, but yet it's covered in shame, it's covered in silence. You know, why do you think, and I want everybody on my panel to answer this, why do you think the shame persists? When we've gotten to a point where we can send our husbands and our brothers and our sons to get for us pads and tampons. People are very aware, they know about periods, but still, there's still some shame attached to menstruation. Dr.
Yeah, so I think the stigma is still there, it's still persistent, but there is a difference. I think if we talk to our mothers and our mothers' mothers, they would say the stigma then was a lot more.
Yes.
What we have noticed is that the first person to teach a girl about her periods, about what a first cycle is, about what menstruation is the mother.
Yes.
And the mother was taught by her mother.
Yes.
And her mother was taught by her mother.
Exactly.
So when we go back to our great-grandmothers,
yes,
who believed periods are shameful, you have to hide it, no one should know you're on your period, you're unclean, that's what they taught our grandmothers. So the stigma reduced a little bit, but what our grandmothers taught probably our mothers is that, fine, it's not so shameful, but you still have to hide it. What our mothers then are able to teach the girls is it's not shameful, it's normal, but don't let anyone know. There's still a bit of shame that is perpetuated because our main educators are mothers. So once we start removing the stigma right from a young age, the girls, and they'll learn that this is normal, they will continue that with their children, their children's children, and the stigma will disappear. The second thing that is quite important in menstrual health stigma is, even as we talk about education and girls' education in periods, there's a focus on girls. Only girls are put aside and educated about menstrual health, but boys aren't. And a lot of the stigma that a woman will feel is because mostly there are boys in the environment. A girl may not be so afraid or ashamed that she's on her period when she's in a world of girls only.
Yes.
But the stigma comes because they experience a world where they're with men, they're with boys, they're with brothers, cousins. So once men are also educated and well informed that this is just part of life, then that stigma as well is able to be eradicated.
Yeah, I like that your take on that. What about you, Michelle? What do you think?
The shame in Big 2025, I could say it's deep-rooted in the society. And cultural beliefs and also in religion beliefs, and it's taken as a dirty thing. You should have your period, but you should have it quietly. You shouldn't be going around telling people, oh, I'm on my period, and things like that.
In the beginning.
Yes.
So traditionally, cycle had a meaning. It had a very spiritual meaning.
Yes.
It had a physical meaning. It was a start of a new thing, a new moon, a new cycle. So it was so informative. And then industrialization came, and they needed to sell to us why we need to have the sanitary towels. It doesn't mean like we didn't have methods of managing our periods, but for them to move from or to market their products, that is where the shame came in. Do you know that? The shame came with the product being produced, and for us women, we need to cover up, we need to do all this very quickly. So, and then industrialization came with education, formal education, where we forgot about our traditional. So it became a culture, and a culture came with shame. That is where we were at the back. But when I spoke to older women, they started talking about how it's a new energy that comes every time you get a cycle. When you're on your ovulation, it's the highest time to perform at work. It's the highest time to do something and achieve. And then the last day of your cycle, Ashiko, you're negative 150% energy. You do not have energy. So women used to understand that cycle and be productive. Very, very
and be
productive.
able to plan themselves.
Exactly.
Yeah.
But now industrialization, when it came in, they needed to market this product to us and tell us this product will change your life, which it totally changed the life, but changed the meaning of the cycle. So right now, for us to undo the stigma, we need to go back to the traditional. I'm not talking about culture and taboo. Culture and taboo says we should not talk about it, we should hide this, we should But if we go back to the traditional, like the way we are going back to traditional food, traditional medicine, there's a lot to understand about the cycle. So how do we undo the stigma? It's going back to the traditional.
Yeah, and understanding the cycle. I like the fact that you're calling it a cycle. So we're not just looking at the period, the 4 days, the 5 days. You're looking at how did you get here. And I like that. And what you've said, you know, there's some truth to what you're talking about in terms of industrialization. Because if you ever look at, you remember the advertisements for Always?
Yes.
And they would always use blue. You know, why wouldn't they use beetroot? You know, like something that is red. It was always blue. There'd always be things like odorless.
Yes.
So we already grew up knowing that this is something that is dirty.
Yes.
You know, this is something, when you have an accident, it is, look at even how I'm saying, even from the phrasing, you know, an accident, umestain, umejichafua. So those are some of the things that I believe were perpetuated, you know, through media even, through the language that was used, through the stigma, through all of these things. So thank you so much. I really appreciate those
just
insights.
to add something before we move on, also religious beliefs came with a turnaround. I am a Christian, I am a believer of Jesus Christ, and we hold on to the place where they talk about the menstrual cycle being unclean, being, you know, we hold so much on it, and we do not talk about how it's a beginning of life. Without cycle, how do we even start life? How does a child come to be? How do you come to be as a human being, you, yourself? It's a sign of cycle. So also religious belief really is one of the biggest hindrance, one of the biggest barrier for us to remove the stigma. It's one of the stigmatization weapon that people have used to weaponize the menstrual cycle.
Absolutely. I completely agree with you. Thank you so much for that, Jerry. Let's move on to what are some of the most common. Now we've talked about the stigma, but there are definitely challenges. When we started off, we talked about some painful disorders. We talked about some, you know, some cultural barriers that even stop someone from going to get the help that they need. So what are some of the most common menstrual health challenges that women face? And when should somebody seek medical attention?
We'll start by the general definition of menstrual health.
Yes.
So menstrual health is not just a lack of disease when you're during your period or during your cycle. Menstrual health is the total mental, physical, and social well-being around your menstrual cycle. So it is not just about whether you're in pain, it is also about how am I mentally when I'm there and having my cycle, how am I socially. So some of the social, I'll start with the social aspect and we'll come around as we continue to the medical side of things. But the social aspect is what we are hearing about left, right, and center, especially in our underdeveloped countries, where we have majority of girls who don't have access to sanitary care. They don't have access to pads. They don't have access to reusable pads, nothing. So they miss school. And that'll come back to Jerry as well, where she'll tell you why there are a lot of teen pregnancies. It boils down to the cycle. So some of the social aspects of it is lack of sanitary products for our girls. If you don't have a sanitary towel, how are you going to go to school when you're bleeding? So if you don't go to school, then how are you going to advance yourself economically in any other way?
Absolutely.
So there's a study that was done actually that showed in a particular area there was about 10% of girls who missed about 20% of the year.
Oh my.
So for those girls, you find that they get early marriages, just right from the menstrual cycle, lack of education. So it has a big social and economic impact. Yeah, so that has a big impact on gender equity as well.
Yes.
Yes.
Oh wow! So now we've talked about the social aspect. Now, if we're going back round and we talk about now the physical challenges, what are some of those?
So the physical challenges could include, what we usually say is a menstrual cycle. When you know you're getting your period, you should never have a feeling of fear or trepidation.
Oh dear.
Yeah, you should never be afraid, oh my God, my period is coming, I'll be in so much pain. Do I have my pain medications? What do I have with me? Or you should never be in fear that when you're sitting down, am I soiling myself? That's generally it. You don't have to question yourself too much, but you as the girl who's menstruating, as the woman who's menstruating, should just have to ask yourself, is my quality of life being affected by my period?
Yes.
And if the answer is yes, then there is a problem that may need a solution. So is there excessive pain? Is there excessive bleeding? Are your periods regular? And regular in this case means you're getting a period every 21 to 35 days. So there is a broad misconception that if I don't get my period every month on the 28th, some days it comes on the 28th, some days it comes on the 27th, some days on the 25th, that is irregular. But a regular period comes every 21 to 35 days, and that is normal. Yeah.
Oh wow, I like that. 21 to 35 days. Okay.
Yeah, so those are basically the majority of the physical aspect of things. Mentally, it can also affect you physically, in the sense that a lot of us have PMS, premenstrual syndrome, where what Jerry said, your energy from even long goes, they said 150% less your energy. That is confirmed. So a lot of that time, your energy is low. Some have very low moods. Some actually have depression and anxiety.
Yes, absolutely. I am some. I am some. I think the moment I know that my periods are on the way is if I watch something that's even slightly, even remotely emotional, even an advertisement, even a cartoon, I will cry.
Yes.
And I'm like, oh, there we are. We are coming. So.
Yeah, and this can affect our work. And the unfortunate thing, part of the stigma, is when you go to work and you're like this, what will you be termed? Hormonal.
Oh, you're so hormonal. Kwani,
yeah, that's part of the
ukona
stigma.
mashiru.
That's part of the stigma.
Lord. Yeah.
So basically that's it, yeah.
Oh, wow. Thank you so much for expounding on that. And you know, knowledge is power. And you know, sometimes if we did not have, or if I did not grow up, or we did not have forums like this ones, we would never be as open. I am very open about talking about menstruation and menstrual periods, etc., regardless of what someone may think. So that is where you come to actually understand about PMS. But when I was younger, I did not know what was going on. I just knew that there was a period in the month where I felt like an insane woman. And you start questioning yourself. And you can imagine you can actually make some very poor decisions in that particular period. You know, you can even end friendships until you have forums. You know, you've just gone off on somebody on the phone and over nonsense. So it's good that we have more open forums, more conversation, more information. So even as your young teenage girl is at home and she's firing, how will you know? Even for the gentlemen I ask, I'm like, how do you know? How do you know someone is PMSing? How are you able to tell the difference between PMS and someone is just depressed? You know? So thank you so much for that insight. I'm still on you, by the way. So what about, let's talk about conditions like fibroids, PCOS, endometriosis. How do those conditions complicate menstrual health? And what are some of the early signs that people should actually look out for?
All right. So endometriosis and adenomyosis usually go together. So 1 in 10 women suffer from endometriosis. And the diagnosis, the time it takes to actually diagnose endometriosis is up to 10 years. Wow. So you suffer for 10 years before you get a diagnosis. So the thing that stands out for endometriosis is pain. Pain during the periods, pain outside of the periods, and even during the periods when you poop, there's pain. Pain down the leg, pain on the back, pain.
Everywhere.
Everywhere. Yeah. So that's what we call severe dysmenorrhea. It's just pain during the periods. And a lot of the times it starts when girls are in high school.
Yes.
Where they go, there are those girls, even when I was in high school, I remember there are some girls who every time of the cycle, they would be in the infirmary getting medicine every time of the cycle. So the number one thing with endometriosis is pain.
Yes.
For adenomyosis, it's part of endometriosis. And if we say what endometriosis is, it's the lining of the uterus, the one that you shed every month. It starts growing in other areas in your body. So it can grow in your ovaries, it can grow around your intestines, it grows everywhere. So that's what causes pain. So during the cycle, when you're bleeding and you expect to shed from the lining of the uterus, if there's other deposits around the ovary, around the intestines, they are also kind of shedding.
Oh,
and that's
dear.
why you get a lot of pain.
Oh, yeah.
Now, adenomyosis, the same disease, that this grows inside the muscle of the uterus. You presents with a lot of pain as well, but significantly a lot of bleeding during the period. And a lot of bleeding in the past we used to describe as 80 ml in a period. But how can someone quantify 80
You
ml?
can't.
You can't.
Yeah.
So what we say now is any bleeding that you think is too much, that is enough for a doctor to say it's too much. Okay? So anything that affects the quality of your life. Now, fibroids as well are benign tumors that grow in the muscle of the uterus. They're very common, especially in black women, and mainly because of our genetics. If you get to a certain age, you'll find 80% of black women in a certain population will have fibroids.
Absolutely.
The menstrual effects of fibroids, depending on their location, because they have menstrual effects and they have non-menstrual effects. So fibroids can cause, again, very painful periods, very heavy periods, but it can also cause non-menstrual effects depending on their location. So if you have a very large fibroid, your periods may be normal, but you may be getting pressure symptoms. So you may be going to pee a lot, or not emptying your bladder completely, or having constipation, or difficulties in conceiving, things like that. So for PCOS, PCOS is what we now see very commonly in young girls, and the main presenting symptom, the main one, is periods do not come every 21 to 35 days. So some people come and they say my period is coming every 5 months, my period is coming every 6 months. So that starts to actually psychologically affect them.
Psychologically, absolutely.
Yes, on top of the medical aspect, psychologically, they get a psychological effect in that, am I still a woman? Are my hormones normal?
Yeah.
So PCOS is just mainly a hormonal imbalance that we say, simply put, there's a lot of insulin resistance, but there is management for it. So if you notice as a young girl that your periods are going very far apart without coming, or you're noticing unexplained weight gain, or you're noticing unexplained acne, or you're noticing hair where you shouldn't have hair, like male pattern type of hair, so hair around the chin, hair around the mustache area, those are things that should trigger you to see your doctor, and you shouldn't wait for years and years before you see the doctor.
Wow. Thank you so much for that. And I really hope that even you at home or even in my audience, you're taking notes. You know, if there's certain pain. Actually, you know, I liked what Dr. said. If you're feeling some type of way, either mentally, physically, psychologically, and it's not helping you, if your periods are stopping you from functioning, then it's definitely time for you to seek help. From your campaign, what are some of the most heartbreaking realities that you've witnessed? Because it's been going on for how long now?
We started it last week.
Yes.
But, you know, we run an organization that empowers teenage mothers.
Yes.
So it's just looking at the root causes of teenage pregnancy. For me, I've been so keen to learn on the root causes, just to inform the people who follow and the people, just schools and all that.
Yes.
And then one day it clicked. The shame, the stigma of menstrual is one of the leading cause to teenage pregnancy.
Absolutely.
Because it's never named, it's attached, but it's never really defined. Because I looked, most of the time when you go to the schools, the girls, when you're giving sanitary towel, they take and they, you know.
And they hide.
They hide very quickly.
Hata wakienda kwa duka. Don't you go to the shop and your pads are normally covered with like 14 liters of newspaper?
Of newspaper.
Every time. You know, I always throw it away. I'm like, Neke,
Yes.
what is it? You've been put for there a whole nini, to carry on.
Yes, and then when the girl stains, they don't say it's menstrual, wanasema imepita. So at first I was trying to understand, nini imepita. And then they're like, imepita. It's something that you're supposed to cover and all that.
Yeah.
And then the same way we are hiding menstrual period, it's the same way we are leading our girls to teenage pregnancy.
Absolutely,
How?
yeah.
We are not talking about the root cause. We are not talking about what menstrual stands for and what. We are not giving them very depth information. We are giving them information, but not enough information. What does menstrual identify, or how does it identify to you as a woman? It's usually how you're supposed to cover it, instead how you're supposed to celebrate it. Me kwanza, I'm encouraging mothers, when your girl gets menstrual, go get an ice cream, celebrate it like it's a trophy. It's power for women. That's not how it's presented. And the same way we are silent about that is what is leading to teenage pregnancy. Because when you talk about menstrual cycle, you have to talk about sex.
Yeah, you do.
You have to educate your child about sex.
You have to talk about ovulation.
Exactly. You have to talk about what happens to your body as a woman during ovulation. Don't assume when you're older and you're married, that's when you have reaction. It starts when remember yourself when you were 16, 17. You used to see cute boys and they were not cute yesterday.
Yeah. So what were some of the reactions?
Now they all of a sudden, Shiko, they are cute. Tell
Yeah.
your child why they are cute. It's just there.
Like what is happening to their
In your body. So that is it. What came out of the campaign
yes.
was a lot of backlash. And I think it went viral because it was a lot of argument. Number one, religious centered people, that's what I would call it. They were there to quote the Bible and how the Bible says it's dirty and clean and how we should not show our blood in public. Actually, most of the people told me it's very easy for people to cast spell on me because I'm showing my blood. Yes, okay. It was that bad. And then there were another group of people. These are majority women. Men came with the approach that this thing we as men should not see this.
Yes.
Toa sweater ujifunge. What are you showing us? Our mothers had it. We never saw it. So I'm like, am I your mother? Sorry, guys. I just thought, am I your mother? You know, I'm not your mother. What am I trying to prove? Yes. And then there is another group of people that really talked about shame. Are you not shameful? This is disrespect to yourself, disrespect to the community. Yes. And then I'm thinking, if I was seated in the matatu going home, this happens, what am I supposed to call the earth to break so that I hide in there? What am I supposed to do until the next nini? You know, that I even tried to stop a matatu to enter matatu yetu.
Oh, dear.
So that is how much it's seen as a disrespect, it's seen as a shameful thing, it's seen as a disgrace to myself. Yes, that was the reaction.
That was the reaction.
Very 10% were women saying, yeah, we need to talk about this, we need to bring it. Very few a number of women were there to really speak about it.
Oh, wow. Please tell us something. So there's been a change in the market for reusable menstrual products. You know, like cups, we are talking washable pads, we're talking panties, and all of them are gaining popularity amongst Kenyan women and girls because they have been seen as safe, they've been seen as practical, they've been seen as respectable alternative. What inspired the founding of Grace Cup, and how is it changing the conversation around sustainable period care?
So what inspired the Grace Cup is the personal need. As women, we have really suffered with the disposable. Let me say suffered.
Suffered,
yes. So rashes, some have severe pain because of the pads. Due to the chemicals they manufacture the disposable pads with. Also, like the way we said at the shop, they try to cover it up and give it to you. And I saw in China, they usually manufacture them in a paper that doesn't make noise. So we have many products. You've not mentioned one. We have menstrual discs.
Yes.
This is also similar to the menstrual cup. It's a reusable product whereby it's inserted. And people are like, why are we inserting things? We should just stick to what we know, the pads. We also have the pads, but for the modern day woman, we are here for them.
When we're growing up, we're being told when you use a tampon, you know, you're going to break your virginity, and I think they were shunned. And I think the first time I got a packet of tampons, I hid them so far away, like, you know, I mean, my mother was progressive, so she got one for me, but it was, But as we carry on the conversation, let's take a short break, and then we'll be back for the question and answer session, as we have this very enlightening conversation, and we, in a bid to break the silence on period shaming. Don't go far away. welcome back. This is the question and answer session of Dada's show. Remember, we are coming to you from Pullman, Nairobi, here in Upper Hill. And this is my favorite part of the show, which is an opportunity for my wonderful audience to interact with my panel. And we can ask the questions. And I'm sure you also have questions at home. So be sure to engage us and keep this conversation going across all social media platforms at KBC Channel 1, Ashiko the host, and of course, Dada's Show KBC on Facebook. So let's get the ball rolling. Let's start off with our first question of the day. That is from Linda. Linda, karibu sana.
I'd love to know what interventions are there to deal with issues like dysmenorrhea, which is one of the issues I have been dealing with during my menstrual journey. What interventions are there to help people? What are the signs to look out for? Because some people only experience severe pain, but they don't have the issues, for example, fibroids, cysts, and all that. So now, is contraceptives and prescription painkillers the only solution, or are there other interventions to take care of the problem? Thank you.
There's something very important that I'd like to point out from just your question that you've said, especially with endometriosis. You may have severe pain, and just like you, go do an ultrasound and you'll be told what? Everything is normal. But endometriosis is a big culprit of doing that, actually, being present but still being there. So there are different types of endometriosis, and there's one that's obviously visible when you do the scan. But for endometriosis specifically, and this is something that should be known, it is the #1 cause of the severe dysmenorrhea. Number 2, to diagnose it, you can't just do an ultrasound. Nowadays, in Kenya, one way we are helping as gynecologists, we are trying to help the girls and trying to help this endometriosis, not just talking about it. We have endometriosis specialists. So one thing I would say with severe dysmenorrhea, especially endometriosis, adenomyosis, it's always advisable to do an ultrasound with a specialist of endometriosis, not just a gynecologist. In this case, you may be able actually to get a diagnosis and manage it specifically. So the first thing is a diagnosis. Do not settle with you have nothing, you're okay. Look for a specialist and get the correct diagnosis.
And of course, you said what stands out is the severe pain.
Severe pain.
You know, and I think that is a call to action for all of us women to actually, just not ignore, be very keen with our bodies, especially during the times or when we're expecting our menses. If something feels off, then don't just say, go see a doctor. But even better, go see a specialist. Thank you so much, Daktari, for that. Let's move on to the next question. That is from Sharon. Sharon?
I'm asking that are these products we use, like pads, are they good for everybody to use them? Like everybody, even when you have any disease, you can use them, or it is not good?
Now, for the disposable pads, they usually have a smell. The chemicals used to make them, when they come in contact with your blood, they produce a really bad smell. But with our pads, they don't have a smell. The bamboo charcoal fiber just absorbs it, and you can wear them for up to 12 hours.
Oh, wow.
Because it's not speakable for the disposable pads. You can't wear them for that long, because it'll start to burn and itch and
that
smell.
Is true. Yeah.
Yes. So the pads are made of that cloth just to ensure that you're comfortable throughout the day without thinking about any other thing. Yes, so the pads are usually reusable for 3 years. The disc and the caps are reusable for 10 years. And all can be worn for up to 12 hours. So
yeah, that's very helpful, especially in this here economy.
Yes.
So now the reusable ones, because like you said, people have different flows. In this reusable for the pads, do they come in different sizes, or it's one size fits all?
Actually, I'd say we've been woven into this mentality that we usually bleed a lot. Yes. So as Daktari had mentioned earlier, for you to say you have a heavy flow, you have to menstruate at least 80 ml. Now, if you had a cup or a disc, you'll know that I have a heavy flow, because we have one for a 65 ml. If it fills up twice in a day, you'll automatically know that you have a heavy flow.
Oh, wow. Thank you so much for that. I mean, definitely you've been given an array of choices that we have, that Grace Cup has. And I'm so happy because long are the days where I believe, like, I think our mothers, my mom was telling me stories of it was only cotton wool. Imagine. You know, that was there. So you can imagine the infections that will come out from that. So we are so, so grateful that innovation, hata kama industrialization and later to shida, at least now innovations are coming back to something that is more Kenyan friendly. You know, it addresses the different economical status that we all belong to. And yeah, so thank you so, so much for that. Let's move on to our next question from Carol. Carol, karibu sana.
Okay, this goes to Daktari. Now we are here embracing the new techniques that have come, like the Grace Cup, the menstrual cup. And now my question is, how safe are they? You realize they're telling us we can reuse this cup for 10 years, some are there for 5 years. Are there any kind of side effects you've seen with time, or how safe are they to the body in the long run?
Good.
Thank you.
All right, so I'll start with specifically the Grace Cup. The Grace Cup is made from medical grade silicone, and it has no chemical coverings. So it is sufficient enough to use the Grace Cup, clean it with soap and water, and sometimes they provide some solvents to clean it with, and it can work for 10 years. However, as we are advancing with these reusable products, there are some that actually come coated in chemicals that are being studied right now, whether they affect pregnancies, whether they affect births, whether they affect cancer rates. And some of these products, the thing is, there's no regulation. So what is important before you buy any product is to confirm and check on the package if it has been individually tested. So these companies individually test their products because there's no regulation. And if it hasn't been individually been tested, you'll get examples of PFAS free or top chemical free. So you have to be very diligent in your purchases. Yeah.
Oh, wow. Thank you so much. And like when we're just doing most purchases, you know, because there's no and I really hope that there'll be a regulation soon to do the checks and balances, because people, you know, we like jumping on trends. We like, oh, this is a fad, let's do this, let's do that. And we do not know what we're ingesting, what we're putting in our body. But I'm very happy to know that Daktari has said A-OK for Grace Cup. So let's carry on. Our next question is from Monica. Monica, karibu sana.
Thank you very much, Ashiko, and your beautiful panel. My question goes to Daktari. And I am bringing this in a disability way. My daughter is 9 years old, and she started the menses. This is the second month. And she has been on anticonvulsants to control seizures, which I think is the reason she got the menses very fast. My question is there a way to stop the menses from coming? And if it is there, are there any dangers in the same? Because as a mother, I'm worried sometimes, you know, she's on diapers. I even don't know whether it is safe to use a diaper as a pad, or to use a pad on top of a diaper. It's a whole confusion.
Carry on, Daktari.
Yeah, so that's a good question. And it is possible to stop the periods based on someone's disability. If it is, again, we've said periods should not affects the quality of your life to a majority negative, right? So what I would advise in that, because I would say there is medication, majority of it will be hormonal, but because I have had a bit of the history of your patient, what I would advise, it is best to see a gynecologist so that they can get their full history, all the medications that they're on, and then you can state exactly what it is that you want to do, and you can work together with your gynecologist to come up with a plan, but it is possible, yes.
Okay. That's good to hear. 9 years old. Wow. Okay. Thank you so much for that question. Let's move on to our final question of the day, which is from Edna.
My question is to Michelle. So I'm a proud Grace Cup user, but I wanted to find out what are some of the myths and misconceptions that you get about the reusable period products, and how do you address them?
To answer that question, most of the misconceptions that we come around are it is painful to insert the menstrual cup. It will get lost inside the body. Some of them say that it makes one to lose their virginity. And all this is based on lack of information.
Yes.
Yes. So we aim on educating. Yes. So for the menstrual cups, it's not hard to insert and it's not painful. As you insert the cup, it will expand and accommodate it safely. And for the part that it will get lost, nothing can go beyond the cervix. It's a tight fit, unless There's no unless. It won't get lost.
There's no unless.
Yeah, it won't. I don't know what you're doing,
Yeah.
but it won't.
Yeah.
And also, as she said, it can't slide off. Yes, so the muscles kind of enclose it.
Yes, they wrap around it.
Yes.
Yeah. The misconceptions that you're talking about are things that we have actually had, you know, about the
Yes.
cups. Heck, even about tampons originally when they came out. Oh, it will go, it will get lost, it will do this. But you've been told there's no way it's going to go up. Unless, then she said, there's no unless. So whenever doubt creeps into your mind, remember, there is no unless. Brilliant. Now, I have my final question, and I want Jerry, you to answer, because you've had so much exposure into this particular issue. What role, after all is said and done, what role can communities, schools, and even men play in ending the shame, in period shame? Yeah.
Let's start with one big tool, information. Information is power. Let's carry out campaigns around unshaming, removing, destroying the shame of, men's. It's normal, and I would really urge the parents at home, let's be the first people to give our children information. Most of the time we have waited for guidance and counseling, schools. They're the ones who are informing our children, but you are the most trusted human being when it comes to the human being that you brought to the earth.
Of course.
They will trust you more. And if we have that information in depth and in goodness, like, let's celebrate it. Let's talk about the impact that it brings to you as a woman to have your mens. And let's not separate the girls and the boys. For me, as Njeri Kabiru, on social media, I will keep on carrying these campaigns and hoping it spreads all over the nation and all over to religious institutions, homes, everywhere. I hope that in the next few years, and I have the biggest campaign this week was I want to have these uniform periods on billboards around Nairobi. Ashiko ukipiga ile kona, billboard, menstrual, until there's no more shame. Thank you.
Yeah, I think that's called exposure therapy. You know, I think it's called exposure therapy, where you're exposed to something so much, you become numb to it, so you're not looking at something with, gasp, So thank you so much, and we commend you. I want to give you guys I want to give you a minute to give me a parting shot on today's conversation. Let me start off with you, Dr.
My parting shot is very simple. Your period should not affect the quality of your life. Your period is a gift, it's a privilege. So do not suffer through anything during the period without seeking help.
Thank you. I love that. What about you, Monica? Bishal?
I'd like to say that your periods shouldn't be stressful, and we as the Grace Cup are here to aid you to do that.
Oh, wow. You've got support. And finally, Jerry?
It's a new, your period or your menstrual should be a beginning of a cycle in your life.
Yeah.
Enjoy it, celebrate it. Let us pass down the celebration to the younger generation and start a new cycle of life without shame on menstrual.
Oh, periods without shame. Thank you so much. So we've definitely come to the end of today's episode. Remember, our conversation was all about from stigma to strength. So, of course, on behalf of the production team at KBC, my location partner, Pullman Nairobi here in Upper Hill, myself, Ashiko, I wish you all a shame-free week. May you enjoy in your femininity and being a woman. May you get all the support that you need, both from men and women and all the facets around your life. And may you stay safe and protected. But until next time, it's goodbye for now.